My name is Riley Easter. I am an Aspen University nursing student, and this is my Module 1 assignment on the respiratory system. This week we had to build a model of the lungs to demonstrate inhalation and exhalation of the lungs. And we will also be talking about asthma. So inhalation or inspiration is the process of moving air into the lungs. When a person inhales, the diaphragm contracts and intercostal and scalene muscles increase the chest dimension, which is also decreasing the intrathoracic pressure. During exhalation or expiration, the movement of the lungs is forcing air out of them. It is a passive action and it occurs when the elastic recoil, which is the tendency for the lungs to return to their original size after being stretched from inhalation. So inhalation, expiration, that's the elastic recoil. The lungs are returning to their original size. And during the exhalation process, the intrathoracic pressure increases. So people have different sized lungs due to the aging process. So when you're younger, your lungs are usually bigger and can hold more lung air capacity compared to when somebody is older. And that is because there is a decline in the lung capacity due to muscles like the diaphragm growing weaker and then lung tissue losing its elasticity, which causes the airways to become a little smaller because there's not as much expansion due to less elasticity of the lung tissues. So asthma affects the lungs with reversible respiratory airflow limitation or bronchial hyperresponsiveness. The airways also become inflamed and narrowed at times during an asthmatic episode, and the patient may show signs such as wheezing, breathlessness, chest tightness, and cough, and attacks usually occur at night or in the early morning. The medical management of asthma may or may not need immediate medical intervention or intervention in general, and it is just due to the fact that continuing or increasing dyspnea, which is trouble breathing, can lead to increased anxiety because the person becomes anxious that they can't breathe, and it can make the situation worse. Pharmacologic therapy for asthma includes short-acting beta and adrenergic agonists, which help relieve acute symptoms and help prevent exercise-induced asthma. Other medications are also corticosteroids, which help with decreasing inflammation, as well as anticholinergics. Albuterol is a common asthma medication, and it is a bronchodilator, and it helps to open up the bronchioles during an asthmatic attack. People either have it in a puff form or they have it in a vapor form. So people can either do breathing treatments or they can use their inhaler and not have a whole machine set up and have the liquid albuterol, but instead they have the aerosol version. Peak flow meters and daily peak flow monitoring is also used for people who have asthma. Peak flow is used to monitor the highest airflow during a forced expiration. So when somebody's breathing out, exhaling, it's however much they are able to exhale out, because that shows what the lung capacity is or how much they had in their lungs. Nursing management for asthma depends on the severity of the symptoms, and the nurse should assess the patient's respiratory status, assess their breath sounds and their breathing pattern. They should assess the patient's peak flow and assess oxygen saturation, because during an asthma attack, the person may be short of breath, which means they're not taking oxygen, which means that their oxygen saturation could be low, and usually you want your oxygen saturation to be 95% and above to be considered adequate. And then you should also monitor the patient's vital signs. Important teachings for somebody with asthma is their medication teaching. It is important to teach the patient about the medication name, what it does, so how it helps them in the event of attack or just in general during the day, the dosage of it, the method of administration, and the schedule of when to take the medication, because usually you should take a medication around the same time each day or before a certain activity where you know that you might have an asthmatic episode, so it's kind of like a prevention measure to help. The nurse should also teach the patient about side effects, what to do if side effects occur, how to properly use and clean their devices. So with breathing treatments, you'll have a tube which is connected to the liquid albuterol, and then there will be another tube that goes into the machine. When you turn on the machine, it turns into vapor, and the person sucks it in. It's important to clean those and keep them dry to prevent mold and bacteria from forming, which if you're inhaling that, that's not good either, and it can cause respiratory tract infections. And then it is also important to teach patients about the consequences if they're not compliant with their medications. They might have more flare-ups of episodes, and their severity of symptoms and attacks might become worse if they're not adhering to their medication. Community resources and agencies for asthma that people can use is the National Heart, Lung, and Blood Institute, the Allergy and Asthma Network, and the American Academy of Allergy, Asthma, and Immunology. And then another good one is the U.S. Environmental Protection Agency. For people with asthma, it is important that someone be aware when high air pollution or a bad air quality day is occurring, because it could make their symptoms worse. It could cause them to be more severe, and they have the higher chance of a flare-up occurring. So they just need to know when it might be a bad day and how it will affect their symptoms, so they can prevent and treat themselves properly to avoid a bad asthmatic episode. Thank you, and I hope you enjoyed my presentation on the lungs.